Hey guys, I want to thank you for joining me on this educational series. The inspiration for these lectures came from when I was studying anatomy as part of my canine rehabilitation course in 2015. It was then when I realized a couple of things. Number one, how faded my textbook knowledge on anatomy was. Number two, I was overwhelmed by the sheer amount of anatomy I had to remember. Number three, I realized that my vet education was biased towards joint pathology and not so much muscular tendon pathology. And number four, I was wondering how remembering all this anatomy was going to make me a better clinical rehabilitation practitioner. It was in 2017 when I was working at the Soi Dok Foundation Hospital in Thailand when I realized I was not the only student struggling. Many of the final year veterinary students that came through the hospital to do their clinical rotation found it difficult to bring theoretical knowledge to clinical application. So it was in 2019 when I had the idea of making these videos as a tutorial aid for veterinary students. However, I do feel that these video series will help anyone in the industry needing to understand anatomy. I call this the Canine Applied Anatomy series. In this lecture, we are learning the applied anatomy of the canine shoulder. We start by identifying the palpable anatomical landmarks of the shoulder. And here we're going to use a radiographic image of the region to help us identify these points. Accurate identification of these landmarks help us check if the skeleton is in alignment. This is especially important in cases of trauma, where there may be a fracture or dislocation of the scapula or the scapular-humeral joint. Also, knowing the regional anatomy will help us identify the soft tissue structures that originate and insert in this region in a live animal. So, the cranial angle of the scapula, the dorsal border of the scapula, the caudal angle of the scapula, the spine of the scapula, the acromion process, the intertubercular groove, and the greater tubercle are all palpable anatomical landmarks on a live animal. The supraglenoid tubercle and head of the humerus, I've highlighted it out on the radiograph for you. These are important landmarks, of course, but they're not palpable on the live animal. Knowing the anatomical landmarks will now help us identify the superficial soft tissue structures in the shoulder region. These are the muscles that you can palpate directly as they're located right under the skin of the animal. We first take a look at the neck muscles that attach to this region. We have the trapezius, the cleidocephalicus cervicalis, the cleidobrachialis, both part of the brachiocephalicus group, the sternocephalicus, and the omotransversarius. These muscles have one attachment on different parts of the spine and some from the skull, and the other attachment to the shoulder region. Then directly overlying the lateral shoulder and forearm, we have the deltoideus, the long head of the triceps, and the lateral head of the triceps. On the medial aspect of the shoulder, we have the subscapularis muscle, the teres major, the supraspinatus, the latissimus dorsi, which inserts with the teres major onto the teres major tuberosity. We have the long head, the accessory head, and the medial head of the triceps, the biceps brachii, and the tensor fascia antebrachii. The muscles of the cervical spine will be covered in a separate lecture. In this lecture, we will look at the superficial and deep muscles of the lateral and medial aspect of the shoulder. The first muscle we will look at is the deltoideus. The reason this muscle is important is because it is the most superficial muscle you're going to palpate on the scapula. One of the important indication of limb use is the condition of the muscles of the particular limb. Therefore, if you find that the shoulder muscles are atrophied on one forelimb and not the other, it means that the animal is not using that limb as much as it should. You will also find unilateral muscle atrophy after direct trauma where there's damage to the myocytes or as a result of denervation atrophy. So if we have a look now at this image, you can see that the proximal attachment of the deltoideus is the spine of the scapula. The distal attachment is not so very obvious in this image, and it is the deltoid tuberosity, which is on the lateral aspect of the humerus. Now, by knowing the proximal and distal attachment of a muscle, you can kind of figure out the action of that muscle group. So the deltoideus functions to flex the shoulder and abduct the shoulder. So if you think about when you're at the gym, holding the dumbbells and moving your shoulder in this way, this is actually shoulder abduction, and what you're doing is working your deltoid muscle group. The other clinical relevance of knowing the deltoideus is that it is one of the 4 forelimb muscles in a dog that is prone to contracture. So if you're noticing that your patient actually has short proppy strides on gait analysis and on your clinical examination has very tight shoulder extension, deltoideus muscle contracture is something that you'd want to consider. The next muscle group we're going to look at is the long head of the triceps. The triceps muscle in general is an important muscle group to know in the forelimb. As you can see, it makes up the bulk of the caudolateral muscle group of the brachium. So, why is it important to know this muscle and its function? It is a major postural muscle of the forelimb, meaning that a well-functioning triceps extends the forelimb to help the animal hold its posture upright. If it is weak for any reason, you will notice that the animal appears to be sinking in its forelimb. It is also a muscle group that has predominantly type 2 muscle fibers, which means that it is needed for power and strength. This is especially important in performance animals. The less commonly known thing about the triceps is that it is a muscle that is prone to trigger points. Trigger points are focal areas of stress that develop in the muscle belly, usually at the neuromuscular junction due to chronic abnormal loading. This is the result of secondary compensation due to a primary problem locally or elsewhere in the body. Stiffness and shortening of the myofibers in this muscle group can lead to reduced shoulder extension. The animal may appear to have a short proppy gait in the forelimb. So let's figure out the proximal and distal attachments of the long head of the triceps. So if you have a look at this image again, you can see that the long head of the triceps is sort of coming off the back of the shoulder. So the proximal attachment of the triceps is actually the caudal border of the scapula. The distal attachment is pretty obvious from this image, and it is the olecranon of the ulna. So we can appreciate that the triceps long head actually crosses 2 joints, the shoulder as well as the elbow joint. Therefore, the action of the triceps is to flex the shoulder and extend the elbow. The next muscle we will look at is the lateral head of the triceps, which by its description is the most superficial muscle you will feel on the lateral aspect of the brachium. So let's have a look at its proximal and distal attachments. The proximal attachment is the tricipital line of the humerus. Its distal attachment is the olecranon of the ulna. So you can see that the lateral head of the triceps only crosses 1 joint, which is the elbow joint. So the action of this muscle is to only extend the elbow. So let's go ahead and look at this video to identify the triceps group of muscle. We first identify the greater tubercle, and then the olecranon of the ulna, and this is the lateral aspect of the triceps muscle. We go ahead and palpate deep into the muscle belly, looking for trigger points, and also having a general feel of the bulk and tone of the muscle. We then go ahead and look at examination of the triceps in lateral recumbency. And here once again, identifying the location of the triceps, and what I'm doing here is palpating more into the long head of the triceps. Going all the way up to the shoulder, and this is usually where you'd find the triceps trigger points, right behind the shoulder joint. Okay, so let's now look at the deeper muscles that overlie the shoulder area. We have the supraspinatus, infraspinatus, teres major, latissimus dorsi, teres minor, the triceps long head once again. Triceps accessory head now becomes visible after we've removed the lateral head of the triceps. We have the brachialis and the biceps brachii. The supraspinatus and infraspinatus groups are the first pair muscle groups that we're going to look at. Clinically, it is important to know the anatomy of these muscles for a few reasons. Number one, they are both prone to muscle atrophy and therefore are indicators of limb use. Number two, the supraspinatus tendon is prone to tendinopathy and therefore can be a source of forelimb lameness. Number three, the infraspinatus muscle is prone to contracture. It is actually one of the 4 muscle groups that are prone to contracture in the forelimb and therefore can reduce range of motion of the shoulder. Both the infraspinatus and supraspinatus are prone to developing trigger points, which can be a source of pain. The proximal attachments of these muscle groups are fairly obvious from this image. You can see that they are literally stuck to the scapula. So, the supraspinatus originates from the supraspinous fossa and the infraspinatus from the infraspinous fossa. And distally, the supraspinatus attaches to the greater tubercle through a thick tendon insertion, and the infraspinatus just attaches lateral to the greater tubercle. It's fairly obvious in this image as well. So knowing this is really important because clinically, if you have an animal that exhibits pain on shoulder flexion, most of the times we're thinking about joint pathology, osteoarthritis of the joint, or in some cases OCD lesions of the joint as well, but no one really would think about a tendinopathy. However, supraspinatus tendinopathies are actually quite common tendinopathies in the forelimb. And the reason why it's painful on shoulder flexion is because we're actually stretching the insertion point of the tendon. Looking at the action of the supraspinatus and infraspinatus muscles. So the supraspinatus functions to extend the shoulder as well as stabilize the shoulder. And the infraspinatus, it actually causes shoulder flexion or extension depending on its position. It is the cause of shoulder abduction and lateral rotation. It also functions to stabilize the lateral shoulder. So it's a bit more of a dynamic muscle rather than the straightforward supraspinatus muscle. So let's go ahead and watch this video to have a look at some of the anatomical structures that we can palpate around the shoulder joint, including the deeper muscles of the shoulder, the infraspinatus and supraspinatus. So first identifying the spine of the scapula, following it all the way down until you reach the acromion process. And from there locating the greater tubercle, which can be found on the cranial aspect of the shoulder. Then we palpate on either side of the spine of the scapula, palpating deep to the supraspinatus and infraspinatus, just checking for muscle texture as well as trigger points. And this is actually a good time to feel the degree of muscle atrophy of the shoulder region. We then palpate the spine of the scapula to check for any fracture sites or pain. And this is of course important in dogs that have sustained trauma. The latissimus dorsi is another fantastic clinically relevant muscle that we will look at. And although it is not a muscle that directly overlays the shoulder region, because of its clinical relevance and its insertion into the shoulder region, we will cover it in this presentation. The latissimus dorsi is prone to developing clusters of trigger points. Once again, if you find trigger points on your clinical examination, this is suggesting that the animal is overcompensating on a particular side of its body. And so you will need to then investigate to the underlying problem. The proximal attachment of the latissimus dorsi is the thoracolumbar fascia, and distally it inserts onto the teres major tuberosity of the medial aspect of the humerus with the teres major muscle. The action of the latissimus dorsi group of muscles is to flex and adduct the shoulder. It also draws the trunk cranially during motion. Let's have a look then on this video on how we look for latissimus dorsi trigger points during our clinical assessment of the dog. So here I'm highlighting the general region of the muscle, and then I palpate deep into the ribs of the dog right behind the shoulder joint. And this is where the clusters of trigger points in the latissimus dorsi will be located if they're going to be present. The next pair of muscles we will look at are the smaller muscles of the shoulder region, the teres major and teres minor. Clinically, the teres minor is of importance, and it is one of the 4 forelimb muscles in the dog that are prone to muscle contracture. It is also prone to muscle strain. Therefore, it is quite essential to know where these muscle attachments are. Proximally, the teres major comes off the caudal angle of the scapula. It is fairly obvious in this image. You can see it quite clearly. The teres minor originates from the infraglenoid tubercle of the scapula. You can't see that obviously on this image. Distally, the teres major inserts onto the teres major tuberosity, which is located on the medial aspect of the humerus, and the teres minor inserts onto the lateral aspect of the humerus onto the infraglenoid tuberosity. So knowing this, if you do get an athletic, active dog with forelimb lameness and there's pain on full extension of the shoulder, besides osteoarthritis and OCD lesions, you want to think of teres minor injury. So the reason why it's painful on extension is because you are stretching the insertion point of the teres minor muscle. If you find this and you directly palpate teres minor muscle and it reveals pain, then obviously you have your diagnosis. We now look at the action of the teres major and teres minor muscle. Both actually flex the shoulder joint. The teres major is involved in medial rotation of the shoulder additionally, and the teres minor is involved in lateral rotation of the shoulder additionally. So from the material that we've covered, you can see that there is quite a variation to shoulder pathology. Most times when we find pain and alterations of range of motion on our clinical examination of the shoulder, we immediately think about osteoarthritis or OCD lesions. However, these clinical signs can also be caused by tendon and ligament injuries such as supraspinatus tendinopathies, muscle strain and muscle contractures, so the 4 muscle groups of the forelimb that are prone to contractures, the infraspinatus, the teres minor, the deltoideus, and one that we haven't covered, which is the brachialis. Muscle trigger points and stiffness in the connective tissue of the shoulder region can also cause the clinical signs that we very commonly see with shoulder injury. So let's take a look at this video now to see how we can assess the joint range of motion of the shoulder. So first take the joint into full flexion, and in flexion the limb appears to be like a chicken wing. And then we take it quite slowly and gently into full extension, and in full extension you can see that the limb is parallel to the dog's snout. We now have a look at this video where we are assessing the shoulder in abduction And the reason why we do this is because medial shoulder injury is quite a common injury in dogs, especially performance dogs, and it's quite a common cause of lameness. So to do this, let's have a look. What we're going to do is bring the limb into full extension. We're going to apply pressure on the scapula and simultaneously abduct that limb. Let's watch the video again. Full extension, pressure on the scapula, and then abduct the limb, using the elbow as a lever arm. Normal dogs will have about 35 to 45 degrees in abduction, and if there's increase in laxity in this range of motion, it means that the dog has a medial shoulder instability, generally from tendon and ligament pathology. Alright, our final slide. This is the summary slide. So this is what I essentially want you to take away from this lecture today. Number one, use the anatomical landmarks of the shoulder to help you assess skeleton alignment and identify the location of different muscle groups. Number two, assess for muscle atrophy or hypertrophy as an indicator of limb usage as well as muscle tone. Number three, check for muscle trigger points in the triceps, lat dorsi, infraspinatus, and supraspinatus as an indicator for underlying mobility issue. And number four, remember that reduction in range of motion can be due to joint pathology, pain, as well as soft tissue changes and contracture. So I hope you enjoyed this lecture. Take care.
We know that this is the dog's neck, and when you palpate down the dog's neck, you would reach a bump. This bump is the dog's shoulder blade. This is the cranial border of the scapula. Now, once you've located the cranial border of the scapula, you could locate the cranial angle of the scapula, which is the tip of the scapula on the midline of the spine. Locating the spine of the scapula, we then palpate downwards until we feel a knob-like bony prominence. This knob-like bony prominence is the acromion process. With one finger on the acromion process, I'm going to use my other hand to find the greater tubercle. So I'm going to go cranially on the forearm until I reach a little curved ridge. Palpating up and down, you could appreciate what this curved ridge feels like, and this is the greater tubercle.